I love the long-term patient relationships. I think I was born to be a rural family doctor in that sense, because what I love is seeing people now, and I delivered their babies 20 years ago, and I love the continuity of the families and the patients.
The continuity, being able to be a part of people's lives from when they're quite small all the way up into adulthood and later adulthood, I love that about my job.
I love the small feel of this place, and I love that even though it is small, you're still able to grow. You're working with professionals, you're working with people who really know what they're doing, and they love what they do.
Depends on why you go into healthcare, but if you went in there to gain skills in order to contribute to a community, those skills that are needed, then you should be in a small town.
I think the biggest difference between rural and urban is that we are the doctors for the town. It's more one-stop shopping.
There isn't a typical day. I mean, everything can happen, everything from major logging trauma to heart attacks to depression counseling and the whole gamut. That's the fun part about being out in the sticks, is anything can happen on any day and any moment, and it's very exciting that way.
You're it. You've got to deal with a baby that's not coming out the way that you want them to, or with somebody that's bleeding and you don't have their blood type, and there is nothing else out there but you, and why you have to be there.
So yeah, even though I'm the only doc in town, I am the only doc in town, and I take calls from home and sew people up on Christmas Day on my dining room table. So, whatever happens and whatever they need is what we've been answering the call for.
One of the differences practicing in a rural setting that some doctors find an attraction and some the opposite is you meet people in the grocery store, or you go in your jeans on a Sunday morning to the garden store to whip up something, and there's one of your patients.
When I took this job, my first word was, oh God, I'm gonna live and work in the same small town. And I thought, oh, people are gonna know where I live, and they're gonna know, they're gonna see me out and about. I'm gonna have to go to a different grocery store. But actually, it's been surprisingly rewarding.
I live next to my patients. I see my patients every day at the store or out on the trails, which is just fantastic.
I love that informality and them seeing me as a human being and seeing my kids and just that whole real person side of it.
People here have become my family, so they've all got my number. We're on a first name basis, and it used to be when I was paddling the rivers, they know when I'm coming off and where to come get me.
Community is really important, and it's at the heart of who we are and what we do. We exist to take care of our community.
You really get to know a community well. You get to become friends and allies with the people there as your patients as well. I think together you can work on health issues that impact people before they come in the door to the clinic.
People that go into the medical field are people that want to serve communities, and rural health communities need the service.
Farming communities, electric workers, they're there and they need us.
Every day is a new adventure. Every day is challenges, and every day is our opportunities. And I love that.
My thoughts about working in rural health is, it was my dream. So, I was able to raise a family in a beautiful environment with the support of a whole community. I would do it again.